time. I'm the supervising public health nurse, and I'm here in Ashley's absence today. I am going to be going over the first quarter report for 2019. And I do have a PowerPoint presentation. I am going to give you, the PowerPoint is an abbreviated version of this report, so I do have the full report for you to look at. I'll just take them and pass it down. Okay, so the first few slides are in relation to our Community Health Improvement Plan. And the Naturally Healthy Lewis County app is up and running now. It maps out the locations, where to find the farm stands, the local produce, nutrition classes, any type of physical activity that is available to residents of the county. It's not here on the slide, but it is in your full packet, the QR code, which is what you use to download the app onto your phone. So you can download that and use it, spread the word. We want to make sure that people are aware that it's out there and it is available for use. The physical activity leader training, this was conducted at 4 of the local schools. There were 22 participants who were involved in this training, and it's really the first step for these schools to start implementing the comprehensive school physical activity programs. And just as kind of an interesting slide on the left, it shows a child's brain after 20 minutes sitting quietly, and that's brain activity. And the same child 20 minutes after 20 minutes of walking. So you can see the effect of physical activity, not just on the physical body, but in brain activity as well. Our Suicide Prevention Coalition was awarded a $10,000 infrastructure grant from the Suicide Prevention Center of New York, and that money will help to further the work of that coalition. And in the first quarter, there were 3 community crisis response team activations. So community partnerships, we know that it is vital to have community partnerships for the success of any of our public health initiatives. And in the first quarter, our staff attended 43 partnership meetings, and they led 19 of those meetings. So we realize that we all have to work together in a collaboration to generate that collective impact. The next few slides are statistics on our programs. So seasonal influenza, as of the end of March, there were 397 confirmed cases in Lewis County. It's a little bit lower than the previous 2 years. A little bit less severe. As of May 3rd, the Commissioner of Health declared flu no longer present in the state, and we have had to date about 450 cases of flu in Lewis County that have been diagnosed. In our immunization program, we saw 120 individuals attend those clinics. Lead poisoning prevention, there were 99 children who were screened for lead. The majority, you can see, fell in the 0 to 5 range, which is where we want to see them. There were 9 children that did fall above 5, and we are case managing 4 children currently that have at one time had a lead level of 15 or greater.
Hey, Marcia, before you move on, a note on this program. The state has reduced the activation level. Basically, when we get a case of 15 or more, we have to case manage that, do home investigations with the plumbing and the paint and some other things, right, Marcia?
Yes, yes.
Look at the numbers. So 15 to 19 in 2024, we had 3 cases last year. If the state moves that bar to 5, less than 5, our caseload goes from 3 to 90. And the state is doing that. Next year, the threshold that will activate our investigations, which means a registered nurse has to go into the home, perform the inspections, our caseload's gonna go from 3 people to 90. So that's something to watch at budget time next year, because we're going to have to work with the other counties in the state to figure out how we're going to handle this increased caseload. And by the way, that also probably means more referrals to our pre-kindergarten program. It probably means more referrals to the early intervention program, because now we're tracking these kids and they're gonna get in our system for our other programs as well. So that's a pretty minor thing, you would think, but it's actually gonna activate a big change at the public health department.
How
Mark?
do you know when you go into these homes if the paint has lead in it?
So the state does that. We, as the nurses, we go in and we do an assessment of the child. The state does the assessment on the home, and they have equipment that can determine.
Oh, okay. I don't know how to do it.
So the state says they're going to fund 100% of the additional costs. That's how the language is written at this point, from going to the 15 level to the 5 level. However, you know, there's always more costs, especially if we start getting referrals to our programs through this, you know, this lead testing threshold. So I think Ashley put it quite nicely in an email when her and I were discussing this. She said it's an underfunded mandate. So they're gonna, they're gonna give us some funding, but not enough to cover the full impact.
I'm sorry, I don't usually ask questions, I just wanna be sure I get this right. So they're gonna lower it to above 5, or you're saying from 0? Cause if it was 90 cases, it would be, if they're lowering it to the level of 5 or above, it would be 9 cases. But are they lowering it to below 5?
No, it is 5 or higher.
That's what it's
So,
going
yeah.
to be lowered to?
Yes.
Right now it's
If it-
15?
yes.
Okay, so it'll be
Yes.
9 more cases?
Yes.
Or 9 cases
And
total?
for this quarter, yes, it
For
would
this
be.
quarter, right?
Right.
Right, but the 90 is for all those that were below 5?
Below 5.
I just wanted to be sure I understood.
Yep, you got that.
Thank
You're
you.
right, you're right, actually, yes, it's 5 is the new threshold, 15 was the threshold before.
But, and then when these children are on, they could be on, we've had children on for 5 years. So the caseload, you know, each month when these children are tested, we're gonna be adding them, and they may stay on service for quite some time. So we will be looking at a large caseload.
So when do they come off service?
They
After
have
the
to-
level goes below 5?
After, at this time, it's below 10, 2 below 10, but again, with the new changes, we don't know what that's going to be. We don't have those yet.
So how does
Typically,
it get lower?
They have to, whatever they find in the home, if it's something with paint, they have to correct that area where the child is getting the lead, if they can identify it. We teach about nutrition, different ways that they can eat different types of foods to help eliminate the lead. So there's different measures that they have to do, and repeated blood tests to make sure that the levels are coming down.
What other sources in houses is lead?
Solder and pipes.
Yes,
The
the
copper
older
pipes,
pipes, so they always
soundproof,
test
no
water,
water.
they always test paint surfaces. Certain antiques if people collect antiques, they have them in their home if the child touches them. Old toys. If someone in the home has an occupation that involves lead, they may be tracking it into the house. So, folk remedies, we don't see a lot of that here, but certain cultures use different substances. So, we do a lot
actually,
of
if the
education
paint-
and.
If the house wasn't, if the paint wasn't encapsulated and the child wipes his hand over the paint, they pick it up.
If it's
that way first.
flaking, yeah, they pick up those little chips. Actually, it can just be dust. If it's on the windowsills and the wind blows it, they breathe it in. You can eat it, you can breathe it in and get contaminated.
Hmm.
Yeah.
Thank you.
Okay, so our communicable disease and rabies control program, our nurses investigated 74 communicable disease investigations first quarter. Those are all listed on page 4 in the complete report, and they're broken down by disease type and how they're transmitted. The rabies exposure reports, there were 38 received, and that resulted in 2 people receiving post-exposure treatment. Animal testing, there were 15 animals submitted. 8 of those were submitted by us. Those were animals that had confirmed exposure to either people or pets. and 7 were submitted by the USDA Wildlife Services, and those are animals that did not have contact with people or pets. 2 of those that were submitted by the USDA were positive for rabies.
You don't do the pre-exposure rabies treatments anymore, do you?
We do, if people, particularly people who trap, have some exposure, certainly veterinary staff, we do provide those. Yeah.
You quit that for a while though, didn't you?
No, we used to do titers to make sure that they were, they didn't need to have boosters. We don't do that anymore, but we do offer the vaccine series, yeah. Oops. Okay, our animal control officer we sent out on 4 home visits. And in January, Countryside held the rabies clinic, and there were 59 pets vaccinated that day. Our free clinical services, in our lab, we conducted 7 lead and hemoglobin tests. Those are done together. We did not do any hepatitis C or HIV in the first quarter. The kits for the lead and hemoglobin, those are purchased with grant funds through the lead program. Our free vaccines, these are vaccines provided by the state for uninsured or underinsured individuals, and we provided vaccine to 7 adults and 9 children. And our maternal child home visits, we had 1 infant that received free home visiting. Our evidence-based programs, the diabetes prevention, or the DPP, that's the year-long program promoting health and healthy lifestyle changes. There were 25 participants in the first quarter who lost a total of 131 pounds. And the diabetes self-management program, or DSMP, that's a 6-week-long program teaching skills properly manage diabetes and to prevent complications. And there were 5 participants in that program. Our health communication and social marketing plan, we had media pieces done on the DPP by Linking Lewis County and 7 News. And currently there's a commercial regarding the diabetes self-management program that's running. I don't know if you've seen it on local television, but it's very nicely done. A lot of positive feedback on that. Our Facebook, we posted 44 times. There were over 22,000 views and over 3,000 people either liked, shared, or commented. And this is February is Heart Health Month, and Public Health did a heart health awareness promotion, and these are photos of various county agencies all dressed in red to help us promote awareness for heart disease, and we appreciate that support.
Where there you know?
Hang alone.
Emergency preparedness, planning and response. We had a drill or an exercise on February 27th at our county staging site, which is in the hospital. And the purpose of that was to notify and set up the county staging site and to make sure that we are able to receive large quantities of either vaccines, medications, or supplies in the event of a large-scale public health emergency. Our Children with Special Needs program, these are just the numbers of children who are served in these programs. Quality assurance, I am now doing quality assurance for the agency. And for our immunization program, I looked at 7 records of 63 for quality. And with the exception of the advanced directive info, which is kind of right in the middle there of that graph, all of the other indicators were met at, excuse me, at 100%. One record did not regarding the advanced directives. We are required to offer and document that we have instructed all of our clients who come into our clinic on advanced directives. So for this particular client, it was not documented. So we did provide education with clinic staff, and we'll be monitoring that. Everything else looked good. For early intervention, I looked at 4 of the 41 records, and with the exception of the first indicator, the rest were met at 100%. The one that was not was the client did not receive services in the IFSP in a timely manner, and that was related to physical therapy was not available to start.
What's IFSP?
Individualized Family Services Plan. So we have some new quality assurance activities going forward. We had our Diagnostic and Treatment Center site visit at the beginning of April, and these are, as a result of that, we currently contract with Jefferson County Public Health to conduct sexually transmitted infection testing and treatment, and we are required to QA those charts as they complete them. So going forward, we have a process in place that they are forwarding those charts to us to QA, so we'll be reporting on those. Infection control audit, we're also required to have an infection control committee and review infection control practices in our clinic, and we have created a tool to do that, and I've started conducting those audits in the clinic. And the last one is medical director oversight. He is responsible, our current medical director is responsible for overseeing all quality assurance activities, so he is now part of our QA team, and he did, in fact, attend our meeting last week, so.
So who is the medical?
It's Dr. Root, for now. And that is it for the report. Are there any other questions regarding those?